Hello, everyone, and welcome once more to Radio Voice of Oslo, where we bring you all information around COVID-19, especially in English. Today with me is Dr. Bjørn. Dr. Bjørn works in the ministry and with a very wide experience. He's going to bring us the current state of COVID-19 and maybe what we need to know and what we need to do, especially as we see the infection is going a bit up and down. So welcome, Dr. Bjørn, to the studio.
Thank you so much. Thank you.
Yeah, welcome. Thank you also that you really said yes to come to the studio. As we start, I'll just ask, could you please tell us a little bit more about yourself and what you do currently?
Yes, I'm a medical doctor working at Folkehelse, which is the Norwegian Institute of Public Health. I've been in the field of public health for more than 25 years. We're starting to get a bit old now, but I enjoyed working with prevention and control of communicable diseases mainly, and to work to prevent outbreaks and infections and so on.
Thank you. Now, with the COVID-19, could you just tell us a bit of what is the current situation of COVID-19?
Yes, the current situation worldwide is that it's increasing in most countries, and if we narrow it down to Europe, we see that there was, first we had this big peak in March, April, then it came under control in most of the countries, and over the summer it was quite low. We had very few infections at all in Norway and very low rates. And then towards the end of summer vacation, people coming back from travels, people getting back to their normal habitats after summer, we started to see increases in some places. We have small outbreaks, we have clusters of infections, and most of them we were able to control because it was like a close group of friends or special things happening. And that has been controlled in most of the municipalities and most of the cities around in Norway. But for the past month, I would say from the start of August, there has been an increasing number of infections in Oslo and some of the surrounding municipalities. And it's not sort of one outbreak or one cluster. It's like one cluster here, then there's an outbreak there, and some extra cases there, then you have school here, and so on. So it seems that we have now leveled off a little bit, so there is no more increase, but it has more established on a higher level, which is one of the major challenges now, is how to get back down again.
Okay, thank you. Now that you're saying like it's going up and down, what is your take on how the information spread has gone out, and more so to the immigrant groups? You know, like
Yes.
We've been seeing your information. You guys have really worked on a lot of articles, brochures, videos, and everything. How satisfied are you guys in the ministry?
I think we have done a lot of good things. We have early on started having good collaboration with many of the immigrant groups, with many of the minority groups, and I would like especially to mention the outbreak we saw in March, April among Norwegian Somali population. That just increased, and then it was a very close collaboration with some of the leaders of the Norwegian Somali population in Oslo, and the authorities of Oslo, and also national authorities. And it was when the Somalis themselves took action and took control of the information in a way that suited the Somali population, that we were able to stop it. But what we have seen gradually is that a larger proportion of the new cases are among people who are not born in Norway. This is how the statistics work, that we can register the country of birth, and as of now, more than 30% of the COVID cases occur among people who are not born in Norway. So although we have done lots of good things and lots of good collaboration with the immigrant populations and representatives of the immigrant populations, we still have a ways to go. We still need to improve the information, to target it better, and to make some of the groups understand better what needs to be done. So we have a good way to move now. And what we have seen the past few weeks, because these statistics have come up, we have the government has allocated more money to support civil society, frivillige organizations, NGOs, in order to target better the information to their groups. So there is an understanding that it's still a lot of work we need to do, but work that we need to do together.
Thank you. You've talked especially on the immigrant communities, and it's true. I know, like a lot of people, this information probably either has not reached them, or probably they have not grabbed the nitty-gritties of the information. Do you think there is something that immigrants also needs to do, and also especially this category of people who maybe they came from their home countries, not educated, so it's like getting and searching for information is not quite of their day-to-day thing. Do you think there's anything that can be done or they should do?
Yes, there is a lot we can do, and because if I am to make information, I use my experience, my vocabulary, and very often the people I talk to, they have a different background, they have a different understanding of the words I use. I have sometimes explained that it's not only language that you need to translate into a different language, but you also need to translate it into a cultural context. We saw at the end of summer, we had these teenage youth parties in the western parts of Oslo, where these large groups had big parties, hundreds of people there, and that we hadn't reached them with the correct information. They didn't understand how dangerous this was, and these were native Norwegian-born people, and even though they understand the language perfectly, they didn't grab the importance of, for example, keeping distance, keep at least 1 meter distance. In immigrant populations, it can be other things. Like right now, there is an outbreak that has been traced to a large wedding where the more than 100 people attended the wedding. And I know, because I used to live for a couple of years in the Middle East, I know how important the big family weddings are. I lived in Palestine, and I attended the wedding. It was between 1,500 and 2,000 participants to this wedding. So then to have a Pakistani wedding with 120, that's not a lot of people. And but then we need to change the habits. When you have a wedding, which is very important, you need you cannot go around and kiss and hug all the participants and the guests coming there. We need to try to find a way to keep a distance, even though you have a family wedding. And in order to be able to achieve that, we would need to work very closely with the various immigrant groups in order to discuss with them how can we solve this, because now we see that very many of the new cases, they don't, you don't get it on the bus or in the shops or things. It's in the families, it's among friends. And then I tend to be much closer to my friends than I am to a stranger. And then I have to learn that I have to keep a distance also to my friends. And this has to be translated also into a cultural context when in the different immigration populations that have different traditions, different cultures, in order to find out how should we do it here? What is the things in your culture that you keep close to each other? Many cultures are used to hug, cling together. You can see also young girls, teenagers, especially girls, they hang very closely together and they share all the secrets, they whisper to each other and so on. And then it's, you don't keep the 1 meter distance. So you need to learn new ways of behaving.
Thank you. Thank you. You've talked, especially the new ways of behaving. I know the ministry released some new rules recently. How does it apply? And there's this thing of the mask, there's this thing of the gathering at church. I know wedding is a different thing, but also the normal church setup.
Yeah.
What are the new rules?
There are separate
in
rules.
The mosque, for example.
Yes, and also in the mosque that there are separate rules for Oslo and most other places. So because of the current increased number of cases in Oslo, they have tightened the rules. So in Oslo, they say that if you take public transport and you cannot keep a distance of 1 meter, then you have to wear, it's mandatory to wear a face mask. And whereas in the rest of the country, it's only recommended to wear face mask if you cannot keep a distance. But in most places, it's not so crowded on the bus, so you can keep a distance. Then in the homes, the general rule is that you should not have a party. You should not be more than 20 people together in the same party in the private home. Whereas in Oslo, they have downsized that to 10 people. So maximum 10 people together. But if it's, let's say, a baptism or a wedding that is outside of your home, it's in a public place, in a hotel or a velhus or some congregation place, then in Norway in general, you can have 200 people. Whereas in Oslo, they have, for the current situation, downsized that to 50 people. But then yesterday, the Prime Minister and the Minister of Health said that they will try, if the situation doesn't get very, very bad, to increase the sizes of groups that can be together to 600. But then you should be 3 groups of 200 people each. So that you don't have the free mixing. That could be, it could then either be in a church or in a concert or in a football game. I think it's easier to picture that in a football stadium, that because usually you are divided into sections in the football stadium. So as long as you don't mix freely among the different sections, then the suggestion will be from mid-October that you can increase the size of the group to 3 times 200, so that's 600 in total. In churches and mosques and congregations, that's considered to be a public place. So then, except for Oslo, which has its own rules, then otherwise you can be 200 people, but you should try. Families and household can sit together, but then you should keep at least 1 meter to the next household, the next family, and the most important thing is to keep the distance. And as I haven't mentioned, always, if you're sick, if you have any symptoms of an airway infections and things like that, you should always stay at home. You should never go out and mix with people. If you have a bad cold, if you have the flu or anything, then always stay home if you're sick. If you're not sick, you can go out, and then you should still stay 1 meter apart from people that is not in the same household as yourself.
Thank you. There are new traveling restrictions now that several countries have become red. Could you tell us some of these restrictions, please?
Almost all countries are red now, so it's become quite easy.
I know.
It's first of all, they only consider countries within the EU or EEA, so it's the countries that's part of the European Union that they're only considered, and I think it's just a few of the provinces in Sweden and most of Finland that is still not red, and a few countries in the Baltic. I don't remember quite whether that's Estonia or Latvia that is still okay, but it's almost, and all the countries outside of the European Union are considered red, which means that if you travel and come back again, you need to stay at home in quarantine for 10 days. So it's not illegal to travel, but it means that when you come back again, that you have to stay in quarantine, which means that you have to stay at home. You should not go out. You can, if you live by yourself, you can go shopping groceries and go to the pharmacy if you need food or you need medication, but you should try to stay at home as much as possible. And you can also go out for a walk, but then you should stay away from everyone. You should not be close to everyone. So that is the rule for 10 days.
Okay, thank you. As you've said, all countries are red, and Norway
More or
is
less.
also part of it. Yeah, in a way, yeah. What is the way forward with this pandemic?
To predict for the future, it's very difficult. But what many have predicted was that we should see an increase in the winter time, in the fall and the winter, because we know that from other infections that you get in the face and in the lungs and so on, you see that it increases in the autumn and in the winter. So we will probably see an increase, and then it's even more important to stay at a distance of each other, to wash hands, and to stay home if you are sick, because that's the most important way to stop it. And as we have seen the statistics, it's especially important then to do this with those who are dear to us, those who are close to us, which is your family members and your close friends, to be able to not to hug and kiss and be very close and very intimate, except the household, of course, but then to keep distance. Like I tell often that when I visit my parents, because they're old. They are 83 and 88 years old now, so they're old and they're frail. And I show them my love by not hugging them, by keeping a distance, just in case I was infectious without having symptoms. I could infect them, and that will be very dangerous for my parents because they are old and they may not tolerate this infection so easily. So and they appreciate that I keep a distance to them. I try to visit them often, and we can have a good time without hugging also.
That is so nice. Thank you. Thank you. As we close, do you have any word for our viewers and listeners as we close?
I would say that we should work together in order to combat this. We need to have the participation from everyone, not only the medical experts, but all people in society. We need to work together to combat this pandemic, and then I believe that we will manage to do so.
Yeah. Thank you, Dr. Bjørn, for coming. And until next time, we hope you're still going to be our guest again the next time. Thank you, our viewers, also for being with us. Up to the next time, we say bye-bye.